So what do you think, you will do say you apply to medical school the first year and for some reason it doesn't work out and you may need to reapply because obviously sometimes it doesn't work out. Do you have something planned within that year while you're waiting to reapply for the next application process?
I have been giving it some thought, and I'm kind of basing some things from what my classmates were saying I should refer to, such as being like an EMT, but always be showing your dedication toward the medical fields. And
well, EMT requires, certifications and classes and all that. You only have a year before you start to reapply again. During that year, aside from whatever your friends tell you, what you want to do, what will you do during that 1 year to improve your application?
I think I would go back to the university and learn some more classes that I think
courses.
Yes, that would have emphasize the medical aspects, such because I know that universities offer a plethora of upper division classes that are pertaining to that field. And
do you think that there are any other courses that you might take other than science that might interest you?
I think I would take some courses that would improve,
like what?
Like my communications. Like even though I am taking a minor, I think I would want to improve my social skills or interpersonal relationship skills. And
that's your minor, so that's things you would need to take. But if there was a course here that you could take that you've always wanted to take and you don't really have to take it because it's not part of your minor or your major, but it's something that you've always wanted to take, what course would that be?
I think it would be speech, but would you still consider that communications?
Kind of communicating, yeah. Anything else besides being in communication?
So, I would actually do more stringent math courses, and I've always wanted to take Cal 2 and Cal 3, but I never really had the time to fit in my schedule. And it's always something I've been kind of interested in, but yeah, I would kind of do more math intensive.
I wanted to talk to you a little bit about, I guess, if you've thought about any specialties that you're interested in. If once you complete your medical program, if you have the privilege to be admitted, what specific aspect of the medical field you'd be interested in?
Well, I would say kind of cardiology. It is an interesting field, but from all the doctors I've listened to, they never chosen their specialty. It was always changed throughout the course of their...
And it will change, but I figured you might have a tentative specialty in your brain that you're looking into right now.
I would still say probably cardiology or neurology, because neurology is a very difficult, it's not as concise or not as precise as cardiology. There are some aspects we're not currently aware of, or why the brain actually works, and it is intriguing to learn and being like one of the probably the stepping stones of progression toward neurology.
Of the medical schools that we apply for under the the UT system, why would you think San Antonio would be good for you? The Health Science Center in San Antonio.
I would say that it is, since it's relative to me, probably within 30 years, and unfortunately I would say it's really close to home. And it just, has
being closer to your family is what you mean would be important to you?
Yeah.
What if you get accepted to, Galveston or Dallas? Would you be opposed to going to those schools?
As opposed to distance, or
just in general, what if you get accepted to one of those schools and not this one? What if you get placed in one of those schools?
Instead of this one? Since it would be a medical school, I would probably just go ahead, but...
Why would you select San Antonio Health Science Center versus Southwestern in Dallas, and those schools? What do you think makes this school special?
I think it does work closely with the VA, and that does help with your learning aspects as you are being having an actual being placed in actual environments, as opposed to such as A&M, which uses it's an environment, but it's all controlled, and everything's always different when you're actually working with in the actual field. But I cannot say anything more about this.
Have you ever been hospitalized in any way?
Yes, I think it was when I was about 8. I had pneumonia.
Do you remember that experience?
Slightly.
Yeah. Do you remember any of the positives and negative aspects of you being in the hospital when you were there?
Wow, it's kind of boring, but I just kind of just remember the pain.
You remember the pain? I'm just trying to figure out, or maybe not necessarily you, but maybe a relative, you've been in a hospital watching the healthcare professionals take care of somebody, that I'm wondering if you remember those things so that you can kind of give me an idea of what your perception of the treatment was, and if there was anything that you thought needed to be changed or adjusted or improved in some way.
Well, I guess that it never really provided me comfort as much as I wanted, because probably, I guess the nurse I was applying to didn't, she was only there to administer, it was kind of injections, but...
What do you mean by comfort? What did you need for her to do? I wasn't aware of it at the time, but I was almost close to, I was in a really severe state, and I just kind of felt like I was just there alone. I mean, sometimes my parents wouldn't even be there. I felt like I was just stuck there. I was isolated, and I kind of want to change that if I were to become. Like, how would you change that? How would you make somebody feel more comfortable and less alone?
I would have a closer relationship with my patients, because the doctor I had would kind of just be there to kind of give me some support, but not as much as I wanted, and I can feel like I could just talk to him. Like, I can explain to him my feelings or what I was going through.
Why do you think that was? What was it about the doctor that didn't give you the feeling that you could speak to him and tell him your feelings?
I just felt like, kind of like when he says my pain from 1 to 10. Like, you're just kind of expecting, or you're expecting him to expect an answer, so you're just saying, probably 3. You don't want him to be like just concerned because you're in pain, but just to care.
So what would if I could wave my magic wand right now and you were him? what would you change? So how would you behave towards the patient instead? How would you make it better?
I would just talk to him like if it was a friend.
Like what? Show me.
Like, hello, like, probably not even in a formal setting, like, just talk to him, I mean, just...
Well, I mean, you're wearing a lab coat, so already it's formal to begin with. So, show me, or reenact for me, how you would do that. How would you make me feel more comfortable and less alone, and make me feel like I want to tell you my feelings, and how I'm feeling?
I would just, like, talk about what's going on, not generally about my health. I defer from the health of the patient for that moment. Just show that you do care, like you want to be interested in them.
So show me, how do you want to be interested in me?
Like any other way, like just what's going on in today's system, like about the recent cases of, what was it? Something not so general, but I'd say the recent Iceland and their the UK for their tax, how they were posted tax, like just kind of get to know the person.
So you would have a casual conversation with them just to kind of get to know them better. Is that what you're saying?
Yes, but nothing to apply against, like, kind of want to like argue with them, but like you can actually converse with them. You don't want to just say, oh yeah, I guess, like knowing them, and then like when you walk in you just want to say hi, but you don't want to just be like, hello, I'm your doctor for today, or I'm here for my patients. And I know some doctors that are kind of like that, and it's kind of the worst in the clinics. They just kind of want you in and out. But I didn't really like some of the, when I went to clinics, I found them kind of rude. Like they just wanted to treat you, they didn't want to comfort you. But I don't know, like maybe they were stressful at the time.
Oftentimes it's more of a time constraint. They have so many people they have to see, and you know they may be perceived as rude, but they're already thinking about another patient or another case, which may or may not be, you know, appropriate. But sometimes it's because there's so many people they have to deal with, not just that one single patient they have in their mind. Well, I think these are, you know, the questions that I have for you. It's good to meet you, good to know you. We'll be reviewing your application, the committee will, and you, as soon as we're done with all the interview process and whatever, you'll be receiving a letter in the mail.
All right, thank you.
It was very good to meet you, and they'll escort you over.